I'd now like to introduce Rachel Levine, Pennsylvania's Secretary of Health and Physician General. Dr. Levine has made fighting the opioid epidemic a key priority. She's spearheaded efforts in the state to establish opioid prescribing guidelines and opioid prescribing education for medical students. A pediatrician, Dr. Levine also teaches at the Penn State College of Medicine on topics related to adolescent medicine and eating disorders. Welcome, Dr. Levine. To lead this conversation, I'd like to invite Rachel Rubine, the Hills Healthcare reporter. Rachel, the floor is yours.
Good morning, everybody, and special thanks to Dr. Levine for being here with us today. Just want to dive right in and learn a little bit about what schools are doing in Pennsylvania to respond to the opioid crisis, what sort of the prevention is talking about, and sort of how and if that the tactics have shifted over time.
So, as the senator was talking about, the prescription opioid crisis is the biggest public health crisis that we face at this time in Pennsylvania and really throughout the nation. Governor Wolf, our governor, is committed to addressing the opioid crisis, and it's really all hands on deck with the administration to accomplish that. And prevention is absolutely critically important in terms of helping prevent young people and others from becoming dependent and potentially addicted to these very dangerous substances. So we do have very robust school prevention programs. Now, we're a state that is decentralized, and so we don't have a state where the Department of Education would set the rules and all the different school districts would follow that. So it's a decentralized state. And so there has been legislation in the past that requires substance abuse education really throughout K through 12. And we have best practices that are used for school districts and superintendents to implement those. Some of the best practices would be those that do what are sometimes called life skills training. And there is an excellent Penn State program that's been promulgated about that, where we teach young people how to deal with stress, how to deal with depression, without turning to negative coping mechanisms like drugs. So really the best programs don't just give a scared, straight message, but they incorporate it throughout the curriculum, and they incorporate it into teaching young people how to cope with the pressures that they have without turning to drugs. There's also a Caring in the Community program that also does that and involves the community. So there are a number of best practices, and we try to promulgate those throughout the state.
And your state has prescriber guidelines, some which are for adolescents. One of the things I noticed and that was interesting was having the doctor talk to a minor as well as the minor's parents about the risk of addiction. Can you tell us a little bit about that and just other parts of the prescriber guidelines?
Sure. So the other aspect of prevention, in addition to working with schools and working with the public, is working with the medical community. And the term I like to use for that is opioid stewardship. Opioid stewardship is that opioids are essential medicines for severe pain, fractures, post-op pain, and severe chronic pain such as cancer pain. But because of previous overprescriptions, we have to learn to use opioids more carefully and more judiciously. And so we have developed a number of 10 actually prescribing guidelines for medical professionals. And all of those have been worked with experts throughout the state, and we have taken those to the Board of Medicine for their affirmation, their acceptance. And one of the guidelines is a pediatric and adolescent guideline. So this was developed with pediatric specialists from throughout the state about using opioids very carefully and judiciously, particularly in young people. As you know, young people's brains are developing, in fact, developing through their early 20s, and they're more susceptible to becoming dependent and potentially addicted to substances. And so we really want to limit opioids to those that are absolutely necessary to medical practice. The legislature also passed a statute that the governor signed that limited opioid prescriptions to 7 days. For pediatric and adolescent patients, unless there are extenuating circumstances, for instance, children with cancer. So it's a balance. We don't want people to suffer, but we have to learn to use opioids more carefully, particularly in young people.
And can you tell us a little bit if adolescent in school has an addiction, if there are resources in the schools, how are they helped?
It's so important to have resources in our schools. And so actually the governor has initiated a school safety initiative. Now the impetus for this are the horrific shootings that we've seen in schools, including unfortunately this week. But one of the aspects is to work with schools, and we have a listening session going on right now about the mental health capabilities for assessment and evaluation in schools. And so we're going school district to school district throughout different regions of Pennsylvania. And we're hearing from teachers, we're hearing from school administrators, we're hearing from school counselors and school psychologists and the young people themselves about the pressures that they're feeling and about what resources are available. Again, with our decentralized system, it's different for every school district, but we're really trying to set up some standards to make sure that young people have school counselors, school psychologists that they can see if they're struggling either with substance abuse or other mental health issues.
What sort of education awareness in school have you found that isn't the most effective method?
Right. So again, I think it's the most effective are programs that integrate it throughout the curriculum, that are developmentally appropriate for school-age children, middle school children, high school students, and that are, again, talk about how to cope with the enormous stresses that young people feel in our society, particularly with social media and other types of those. The ones that are basically come in and give a very scary message one day about drugs or any other type of topic is not effective. I'll give you my own experience. So I'm an adolescent medicine specialist, right? So all I did in my career was see difficult and troubled teens. And when I was at Penn State Hershey Medical Center, and one of my specialties, as was mentioned, was eating disorders. And so one of the worst things you can do is go into a school and talk about all the dangers of eating disorders. Because we're talking about the negative consequences, and the young person hears vomiting, and they get the wrong message. They don't always listen the way we'd like them to, and that's somewhat developmentally appropriate. So it really is building those life skills to cope with things as opposed to one scary message about drugs.
Mm-hmm. And you'd mentioned that Pennsylvania schools have naloxone. Can you tell us a little bit about that?
Yes.
And is it being used?
So in terms of the three categories of initiatives that we're working on, one is prevention, as we've been discussing. The second is rescue. And rescue includes the medicine naloxone, also called Narcan. Narcan's an amazing medicine. All it does is reverse an overdose. You can't get high from it. You can't get addicted to it. It saves people's lives. And so we've had a number of initiatives for naloxone in Pennsylvania. And in fact, I signed, as Physician General, 2 standing orders, one for first responders and the other was for the public, to have access to naloxone. The third initiative, as you mentioned, was a contract with Adept Pharmaceuticals that makes nasal Narcan to distribute free, actually, naloxone to the high schools, the public and private high schools in the state, in case a young person or someone else might overdose in a school. You'd think that that would never happen, but we have had cases of overdoses. In this way, the school personnel could have that life-saving medicine. Another example of first responders in this day and age are librarians. People overdose in libraries, either in the stacks or in the bathroom of libraries. And so librarians have become critical first responders, and we have mechanisms to distribute naloxone really throughout the community.
We're going to go to Q&A in just a few minutes, so be thinking of any questions that you want to ask Dr. Levine. But real quick, do you have a wish list for Congress?
Yes, surprisingly. So the particular wish list that I would have for Congress is sustainable funding for the states. So what we've been working on is what is called the 21st Century Cures Act, which was passed at the end of 2016. And that has provided funding for 2017-18, and now new funding for 18-19. After that, there has been discussion about funding either through the CDC or through SAMHSA, but the mechanism about how the states would apply for that funding and how that's going to be distributed is not clear yet. But that's another year of funding. What we're going to need is sustainable funding over the next 5 to 10 years to deal with this opioid crisis, to deal with aspects of prevention, rescue, And then treatment, expanding treatment, particularly access to evidence-based medication-assisted treatment. In Pennsylvania, our own Senator Casey has legislation that would provide that sustainable funding over the next 10 years. And that's what we need from Congress, because we have to be able to build those relationships with our prevention, rescue, and treatment providers over the course of years to successfully deal with this epidemic.
We'll turn it over to audience Q&A. Over there in the back.
Thank you. I'm Kathy Nickel. I'm a Brookings Fellow working for Congresswoman Annie Kuster and the House Bipartisan Task Force on the Opioid Crisis. The issue of sustainable funding is something that I have been giving a lot of thought to. I'm particularly concerned with the inmate population. You may or may not know, 2/3 of our incarcerated in this country meet the clinical definition of substance use disorder. 1/3 are mentally ill and 1/4 are both. Yet very, very few of them get any treatment. And the states simply do not have the resources, as you've spoken to. I believe the answer to sustainable funding for this population is to repeal the Medicaid inmate exclusion. Right now, no federal funds are permitted to be used for the incarcerated population in state prisons, which are the vast majority of inmates. This doesn't provide the funding, but at least provides a mechanism for which this population could get sustained funding, not only for medically assisted treatment, but for humane health care. And so I'll just ask for your thoughts and your comments on that. Thank you.
So the Department of Corrections in Pennsylvania is dedicated to treating the population, as you've mentioned. As the Senator mentioned, we're not going to arrest our way out of this, and I think that we need to work on all the different mechanisms I've been discussing, as well as robust drug courts, to be able to treat people in the community if they're arrested for nonviolent crimes, and particularly have the disease of addiction, is that incarcerating them is not the best way to treat them. But we do have a substantial amount of addiction in our correctional institutions. We're working on treating that. We're working on getting medication-assisted treatment into the corrections facilities as well. What we've worked on is to be able to turn on Medicaid as soon as the person is discharged, meaning the next day. And so there are some excellent initiatives in terms of using medication-assisted treatment upon discharge, but you have to get people into counseling, case management, and wraparound services, as well as continued medication immediately after discharge from corrections. If it goes weeks or months, most likely the patient is going to relapse.
And there's one question over there in the back.
Hi, my name is Abby with the National Conference of State Legislatures. I was hoping you could talk about support for students both identifying drug problems in their homes and then support or counseling for them if they do happen to have a parent who overdoses or a parent who goes to prison for drug problems.
So one of the biggest issues that we have are young people whose parents, as you mentioned, suffer from the disease of addiction, and they might be in treatment, they might be incarcerated, they might overdose and unfortunately pass away. And so Governor Wolf is working with the legislature on supporting grandparents, essentially, and there's a recent bill that was passed regarding that, supporting grandparents of those children whose parents are unfortunately suffering from that disease of addiction. So we absolutely have to take care of those young people, and having the mechanisms to do that are very important to the Wolf administration.
And we have time for one more question right over there.
Hi, I'm Rebecca Bonner. I'm with the Association of Recovery Schools, and I also head the Bridgeway School, a recovery high school in Philadelphia. Hi, Dr. Levine,
Yes,
how
hi.
are you? Dr. Levine, I just wanted to know what initiatives are being had in Pennsylvania for increased access for adolescents for treatment. Since 2012, we've had 5 facilities close, and leaving us with 3 for adolescent treatment. And I'm always going to be the rallying cry for adolescent treatment.
So
Thank you.
Treating adolescents who are suffering from the disease of addiction is absolutely critically important. You're right, there have been a number of closures, and there are not enough facilities. So the Department of Drug and Alcohol programs would certainly support the opening of new treatment facilities and options for young people. One option for certain young people who might be suffering from opioid use disorder is actually medication-assisted treatment. with buprenorphine or Vivitrol. And so one of the things that we're doing is providing more access to quality evidence-based medication-assisted treatment throughout the state. That program is called PACMAT, not Pac-Man, PACMAT, Pennsylvania Coordinated Medication-Assisted Treatment. It's a hub and spokes model using our excellent health systems and their addiction medicine specialists and then their primary care network as the spokes. So let's use Penn State Hershey as an example. The addiction medicine specialist at Penn State Hershey would be the hub with his or her team, and then the spokes would be Penn State Hershey's primary care network, including family physicians, including internists, and adolescent medicine specialists. And so I've had discussions with the adolescent medicine team at Penn State Hershey about working with their hub on providing evidence-based medication-assisted treatment for teens, in addition to appropriate counseling, case management, and wraparound services. And there's more literature about buprenorphine or Suboxone with selected teens in terms of treatment for opioid use disorder. So that's one way to do it actually even in the community while we're working to open more facilities.
And our time is up, but thank you so much for your insights.
Thank you very much. It was a pleasure to be here.